Hi, this is Shannon Patton with the end of class project report presentation. Why do I want to become a radiology technician? For this report, I chose to write about the profession of radiology technician. I chose to write about this profession because I'm hoping to join the program that FSCJ offers in the fall. I chose this profession because when I was 11 years old, I broke my ankle while jumping on a trampoline. And once they took me to the ER to get x-rays and I saw how everything worked, I found it to be very interesting. What is a radiology technician? Well, a radiology technician is someone who takes diagnostic imaging examinations such as x-rays, MRI scans, and CT scans. What are the statistics of becoming a radiology technician? On average, a radiology technician can make anywhere from 60,000 to 63,000 annually. The job outlook looks great for a radiology technician because there are 246,000 jobs available, and the job security looks great because patients will always need x-rays and MRIs. So why is medical terminology important to a radiology technician? Since radiology technicians work in hospitals and clinics, they use medical terminology every day they work. I'm not sure they could really do their job without it because their job would get very confusing and a lot of mistakes would happen. For example, they could x-ray the wrong part of the body or leg, and when doing an MRI scan, they could scan the wrong area of the body, and that could lead to a misdiagnosis of a patient. So from this point on, I'm going to talk about common medical terms used by a radiology technician. So for the first medical term in this slide, I have appendicitis, which is inflammation of the appendix. I have actually had appendicitis, and when I was getting diagnosed with it, I had to get an ultrasound and a CT scan from a radiology technician. And for the second medical term in this slide, I have bone, which is a type of connective tissue and organ of the musculoskeletal system, which provides support for the body and serves as a site of muscle attachments. The term bone is relevant because if you break one of your bones, you will need to get an x-ray from a radiology technician. So continuing on with our common medical terms used by a radiology technician, for our first medical term on this slide, I have an echocardiography, also known as an echo, which is a non-invasive diagnostic method using ultrasound to visualize internal cardiac structures. Cardiac valve activity can be evaluated by using this method. This is relevant because this could be performed by a radiology technician. For our second medical term on this slide, I have an electrocardiogram, also known as a ECG or EKG, a record of the electrical activity of the heart, useful in the diagnosis of abnormal cardiac rhythm and heart muscle, the myocardium damage. This is relevant because the ECG or an EKG could be performed by a radiology technician. Okay, so on this slide of common medical terms used by a radiology technician, I have as the first one kidneys, uterus, and bladder, or KUB, which is an x-ray that is taken of the abdomen demonstrating kidneys, uterus, and bladder without using any contrast dye, also called the flat plate abdomen. This could be performed by a radiology technician. And for the second medical term on this slide, I have mammogram, which is X-ray record of the breast. This could also be performed by a radiology technician. On this slide, continuing medical terms used by a radiology technician, we have as the first one a neurocognitive disorder, which is a classification of psychiatric disorders in DSM-5 characterized by deterioration of mental functions due to temporary or permanent brain dysfunction, which includes dementia and Alzheimer's disease. These disorders could need a CT or MRI scan for diagnosis, and the CT and MRI scan could be performed by a radiology technician. And for our second medical term on this slide, I have osteogenic sarcoma, which is the most common type of bone cancer, usually begins in osteocytes found at the ends of long bones, also called osteosarcoma. This could need to be scanned with a CT or MRI, which could be done by a radiology technician. So on this slide of common medical terms used by a radiology technician, I have as the first medical term pregnancy, which is the time from fertilization of the ovum to birth of a newborn. I included this one because my sister just had a baby in August, and she had many ultrasound appointments while pregnant, and the ultrasound could be performed by a radiology technician. And for the second medical term on this slide, I have skeleton, which are bones forming framework of the body, site for skeletal muscle attachments. The radiology technician would need to know all the bones in the human body to be able to x-ray the right bone. Alright, and our last slide of common medical terms used by a radiology technician, I have ultrasound, which is the use of high-frequency sound waves to create heat in soft tissues under the skin, particularly useful for treating injuries to muscle, tendons, and ligaments, as well as muscle spasms. In radiology, ultrasound waves can be used to outline shapes, tissues, organs, and a fetus. An ultrasound could be performed by a radiology technician. Okay, so as you can see, there are many medical terms that I have learned throughout this class that could help me with my future job as a radiology technician, but there are also many more terms that a radiology technician uses day to day, and I have stated more of those in my written out report. Thank you.